Sure. My name's Tim Edwards. I'm 67 years old, born, educated in Canada. I've worked all over the world with quite a range of companies, but I've lived now in Australia for 25 years, and I was naturalized something like 20 years ago. The kids all speak Australian. My career, or my interest, if you like, so I had 30 years of commercial experience with companies like General Foods and PepsiCo and DHL. In the last 15 years, I should explain, I came down to run the freight business for Qantas, which was great fun. But in the last 15 years, I've really focused on advocacy in the environmental field. And then I ran into mesothelioma. Yeah, so I should have explained. I've also been married for 42 years, and I have 4 children who are spread all over the world, I'm pleased to say, because they're so conscious of what a small planet we live on. But my wife is a banker, which you'd hate to admit, and my kids go all the way from lawyers to academics in the medical field. So my exposure to asbestos was when I was 18 years old, working in a plant that made bricks and cement for kilns, and incorporated asbestos as an insulator in those materials. I've had no exposure to asbestos since then. So 48 years later, I learn or experience breathlessness as I'm trying to paddle around West Papua New Guinea. My wife is criticizing my performance. And we went through the process of determining that that my breathlessness was caused by a cancer growing in one of my lungs, and ultimately that was determined to be mesothelioma. I think it's interesting to note that for the roughly 10 years prior to my diagnosis, I was carefully monitoring my health, and I had an X-ray every year. No evidence of mesothelioma over that care taken. And so I only ran up against it when we found extreme breathlessness and went through the process of biopsy and so on and so on. So where are we today? I've had 4 different kinds of treatment, which the layman would refer to as chemotherapy, but they're variations on the theme. So I can name them. I don't know it really much matters, but the first treatment was cisplatin, which is the primary treatment for mesothelioma. That didn't work. So we have 4 treatments. We take a CT scan, which is the only way to measure the presence of meso. The cancer has grown. So it's not working, so we switch to immunotherapy. 3 treatments of that. CT scan, the cancer has grown. And then we switch to another one, and I am now on the 4th one, in fact, taking treatment this afternoon, which is a more traditional chemotherapy. The other point I would make is it has been the most unpleasant experience of my life in many regards. Very, very difficult, both physiologically and emotionally. I have a pet peeve, I guess, about the lack of attention being paid to the emotions of patients, because it really matters. But the physiology is pretty tough too. The list of side effects from chemotherapy is long, quite hard to predict which one's going to affect you and how badly it's going to affect you. And frankly, the advice that I received from my entire clinical team on side effects was not great. So, net, we're not going to fix this cancer, it would appear to me. I keep my fingers crossed. But, you know, we're down to the kind of last 5% probability. As a result, my oncologist is saying 2 months ago, he said you've got 6 months to live. By the way, I'm quite okay with that. But you know, that's excuse me, that's mesothelioma for you. It's terminal. It's terminal for everybody. And you can buy some time, but you're not going to cure it right now. That matters. That's why we should care and why we should do something about it. So you're asking what I would have liked to have known at an early stage. Well, here's a really good one for you. Once I learn that I've been exposed to asbestos, what should I do? In my view, that question is not answered by the plethora of opinions that we have in this field. I could register with the asbestos registry office, or whatever they call themselves. That would accomplish next to nothing. And here's the thing that people need to understand about exposure to asbestos and mesothelioma. Your chances of contracting meso once you've been exposed are extremely low. Don't know exactly what the number is, but it's like well less than 1%. Once you contract, like I said earlier, you know you're going to die reasonably soon. The range is quite considerable, but fundamentally it's lethal until we figure out how to cure this. What would I have liked to have known? Holy smoke. There were so many things that I had to learn myself, that I had to find, I had to research and find the answers to. And that in the context of advice from my clinicians, which was, don't use Dr. Google, don't use the internet. The worst advice I could have possibly received. Now that's not true about everybody, and I should have said earlier, everything that I say is about my experience. We all have such different experiences, and it's one of the great problems of cancer that there are so many variables and it's really hard to get your hands around them. As I said earlier, one of the most important ones though to get your hands around is how you manage your emotions and how you're supported. I hope my wife will comment later, because as we call her, Nurse Janet has been critically important. And I cry, literally, for those people who go through cancer and mesothelioma without a committed care. That would be brutal. And there's all the detail, which hurts. Like one of the impacts of cisplatin or chemotherapy is that your mucous membrane breaks down, and you may be subject to ulcers in your mouth, which are very uncomfortable in and of themselves. Make it very difficult to eat. There is a loss of appetite, which I think is associated with that, but also chemically induced. And the combination is an absolute killer, because you want to hold your weight, right? You want to, you don't want to become frail, and we're all aware of that in broad terms. You need to be, you need to eat well, and yet you virtually can't. I'll go back, if you'll allow me. In the literature, we see the reference to fatigue. As a result of chemotherapy and various other therapies and the disease itself, you will suffer fatigue. What they don't say, with one exception that I've run across from the Mayo Clinic in the United States, is that you will probably be depressed. Now, depression caused by cancer or cancer treatment, or because you're scared to death, does it really matter what the cause is? What matters is that we come to grips with it, and that the clinical team treat the patient in such a way that he's a positive contributor. Most importantly, in that context, a cancer patient needs to understand you're responsible. You're leading this team, right? No one ever says that. No one even comes close to saying that. But if you don't take responsibility for learning, for managing the 15 drugs that you're on, there's so much that you need to do to manage your treatment and maintain a positive attitude. Yet the starting point is the understanding that you're responsible. No one ever said that to me. So there was a huge amount of information that, in my view, could have been better delivered. Now, there is also a huge amount of information available, and I have a high degree of respect for the participants. Whether we're talking about individual clinicians, or we're talking about the Cancer Council, or the whatever publication, Mesocare or asbestos care in the US and the UK, there's a ton of information available. And it's well intended, and much of it is good, but there are fundamental errors and this conflation or confusion, or this failure to recognize the emotional impact of cancer treatment and having cancer is one that I'm a little fixated on. It is, as I've said, really important to stay positive. It's important that everybody involved, particularly the clinical staff, understand the risk and harm of depression or of emotional sadness. I don't care what you call it. I don't care if it's clinical. What I care about is it hurts and it harms the treatment. And everybody involved needs to understand that. One way to think about it, if you're an oncologist or a clinical therapy nurse and you've never experienced depression, it's really hard to understand what it is. But I can tell you, as a patient, and not someone who thinks of himself as being emotionally weak, it hurts. And, we need to be straight up about it. It's important to understand that there's a whole field of study in this area called psycho-oncology, which is the psychology of cancer treatment, basically. And they have proven well and truly again and again and again and again that emotions matter in cancer treatment. And frankly, the physiological clinicians don't, in my view, sufficiently embrace the issue. So we go back to the question, what would you have liked to have known? My goodness. right? There's just so much, and it's going to be different for everybody. I think there's a really important role for support groups, which is, I almost laugh when I say that because, you know, I'm a 60-year-old man. I don't do support groups. And yet, I've learned that I needed and value support groups. So you've asked, what advice would I give someone who has been diagnosed with mesothelioma? The first thing I'd say is learn. Research it, talk to lots of people. There are so many organizations, it's almost frustrating that there are so many organizations that I could learn from, because, you know, which one is the right one or whatever. In fact, in the last 3 days, I've just run across, and it sounds funny to say, the Bernie Banton Foundation. I should have been there ages ago, and Bernie was all about meso, and I found the stuff on their website quite handy, and I should have picked it up a long time ago. So do your research, get a second opinion, be sure and talk. Don't feel shy about getting a second opinion. You know, the cancer treatment is so much different from our normal medical engagement. So throughout my life, whenever I met a doctor, I said, I have this problem. He said, here's the solution. We applied the solution. Everything worked away I went. This is how medicine's supposed to work. Well, that's not how it works in cancer treatment. And, you know, frankly, a good starting position for a new diagnosis is understand the clinicians, including the most advanced and the most well-educated, don't actually have all the answers. In fact, they don't have most of the answers. Deal with it. That's a reality. And carers need to deal with that. That's tough. I happen to be a very happy atheist, and one of the benefits of being atheist is that I rely very heavily on myself and my own interpretation of everything, and I have a great deal of confidence. In fact, here's a funny one for you. As a result of saying goodbye to all my friends and family, which I've worked quite hard at for the last 6 months, I'm so happy with them. Right? It's not about me. It's about we are making a positive contribution, and that's all that I can ask. So, you know, get positive, get educated, take responsibility, and do your very best. That's what it's about. That's a really, it's such a big question. Asbestos is not banned in most of the world. It is banned in most of the industrialized world, or at least a good portion of it. Last number I read was something in the order of 28, 29 countries. But for instance, my home country doesn't ban asbestos until this year. It's finally getting around. The legislation is in place. That's ridiculous that we are, as a civilization, exposing people to lethal materials for really quite trivial commercial gain. And this takes me into the whole, unfortunately, morality of the thing. right? Some cancers arise, if you like, naturally. We have a genetic predisposition. Some cancers arise because things that we do to ourselves, like smoking. Some cancers arise because of things that others do to us. I was 18 years old. I was shafted. The Canadian government and the company that exposed me to asbestos has known ever since that I was exposed to asbestos. They did nothing about that. They could have warned me. And the millions upon millions worldwide who continue to be exposed to asbestos, and therefore the outcomes that we've discussed. So, we need to absolutely ban it worldwide. We need to get it out of our houses. Roughly 30% of houses in Australia contain asbestos, and lots of public facilities. And we have waste management firms dumping it throughout the country, unimpeded by, frankly, our irresponsible, non-caring, and you have to call it what it is, immoral management of this particular substance. And yet, you read the literature about asbestos and mesothelioma, you will not find the term immoral. There's so many things that we do, and they are. Why don't we call it what it is and get on with it? And of course, those companies that delivered asbestos to my lungs should be paying me for costing me roughly 20 years of life. They have paid me, that is the Canadian government, $32,000 was the value of my 20 lost years. So what, yeah, you get the point. We need to handle asbestos better. We need to answer that question. If I've been exposed, what do I do? And then we need a cure for mesothelioma. And there's a lot of dimensions to that, but the one that strikes me is we have researchers all over the world working really hard with a lack of coordination. It's almost as if it's the individual researcher's responsibility. There's stuff that we can be researching that's more likely to generate a result than other stuff. And yet, in the absence of coordination, both nationally and globally, we don't get the job done. And it just goes out year after year after year after year. So yeah, let's figure this one out. And again, you know, credit where it's due. The guys are trying hard. You know, it's not like I think scientists are all irresponsible. They're not. But policy is required to guide science. The medical, it's not the skill of the medical industry to develop strategy. And so we need a global strategy for dealing with asbestos and for dealing with the disease. And then I just want to say this really quickly, that there's an organization called the Asbestos Safety and Eradication Agency, which is funded by our federal government to a reasonably trivial extent. My understanding is about $4 million per annum. But the good news is that they've done some really good research in quantifying and describing the nature of the asbestos mesothelioma connection. And they actually have, in a sense, the gall to suggest that they're going to lead the world in this regard. And yet, they are. The Netherlands, Denmark, a couple of other countries doing the right thing ahead of us, frankly, but the vast majority not. And so, you know, we're starting to scratch the surface, I guess is what I'd say. Organizations like the Asbestos Diseases Research Institute and many others just have a lot of work to do to solve mesothelioma. So, as I've said earlier, my wife has been just a wonderful carer. So we call her Janet, or Nurse Janet, and she's done exactly that. And it's been so difficult. So why don't you tell us what a good patient I've been?
He lies. Look, the experience is obviously like nothing we've ever had before, and there isn't a lot of direction given by the medical people you work with. I think it's not top of mind for them, and the discussions are quite narrow to the physical situation that exists. If I had to compare it to anything else that we've experienced, I think, and as a carer that I've experienced, it isn't a lot different than a newborn baby from the point, especially your first child, because you have no idea from day to day what's going to happen, and you don't know why it's happening, both physically and mentally, and you're guessing half the time how to solve it, or how to address it, or how to help. Sometimes you get it right, and sometimes you get it wrong, and I guess that makes it a very difficult situation. What compounds that, at least for me, or has, is with your newborn first child, you have anticipation and joy. In this situation, that's missing, and so it's mentally and emotionally wearing. So that's the big ticket item. That and lack of information. I think the support is there, but you really have to look for it. You really have to seek it out. And when you're in this situation, your mindset isn't, I'm going to explore. Your mindset is batten down the hatches, get through the day, make the best you can of it, and try to be positive. And so when somebody has said you should think about or you should speak to an expert on this, that, or the other, both psychological and physical, you're grateful and you do it. But seeking it out is difficult because you're just not there in your head. That's it for me.
It fascinates me that some of the literature refers to the clinical team. What team? What collaboration? It's almost non-existent. Now that's endemic, it seems to me, from what I can tell, to the medical industry as yet. It just hasn't caught up with the opportunities for automation and IT that and how that contributes to collaboration. But dear me, simple question, you know, my mouth hurts. I don't want to have to wait 2 weeks for an appointment to figure this one out with my GP. And, you know, if it was just once or twice, but these questions flow. And of course, going back to the carer's position, you know, it's actually been an interesting development of our relationship, but it's really hard for the carer to stay positive, you know, given the situation. And let's call a spade a spade. I'm watching my husband die, right? And I'm trying to save him, and I'm trying to minimize the pain, but I'm also trying to, you know, keep the house in order and serve the meals and look after them. Yeah, you know, it's bloody difficult, and so carers need some help. want to go back to this whole idea of collaboration. Out. It's okay, Chelsea. Out.
Chili. You just screwed up.
No. Come on. Yeah, exactly. So I just want to go back to this idea of collaboration because information systems make such an important contribution. But the fundamental need is that everybody who is involved needs to be sharing the same information. And the starting point is for the patient to have that information. And it's so hard to document, you know, what did I do today? What did I feel today? What hurt? You know, what are my questions? And so on and so on. And in this situation of being not as informed as one needs to be, frankly, some of us get a little angry. I mean, some people do, and it being so difficult to get expert advice, and when I do sit down with an expert, if you don't get this resolved in 15 minutes, it's not going to get resolved for another week and a half. That's just so problematic. Now, of course, support groups make a contribution, but it's just the management of the information. If you want to think about that in IT terms, go ahead. If you want to just think about that as the carer and the clinical team and the patient being aware of each other and what contribution each can make. Again, it's an opportunity for improvement. I should also say that I don't think I've made it absolutely clear. The technology of cancer treatment is changing so rapidly. And you'll see this in the work of and on the website of Rare Cancers Australia. There's so much that's changing, and I guess I remain very hopeful that the new paradigms of cancer treatment will be more productive. But at the same time, what's the number, Kate? 60 cancers that just don't get the attention they need because they're rare?
It's over 200.
Over 200. So, and we shouldn't feel overwhelmed by that, because frankly, the new solutions will tend to address many of those in one fell swoop, so to speak. So I am actually hopeful. I'm not so hopeful for myself, but I am hopeful for cancer treatment, and I have great respect and admiration for the work being done by the Asbestos Diseases Research Institute and Rare Cancers Australia. You're asking, how have I accessed the expertise available through the non-government associations of the industry? And, frankly, had I not been proactive, and I wasn't proactive enough, and I wasn't proactive early enough, but when I finally got around to it, it was the individuals at Adrian and Rare Cancers Australia who pointed me in the right direction so that I could get better information. And by the way, it's a two-way street, because those organizations need to hear from patients.
My take on that was the first time you showed any enthusiasm for real enthusiasm for as an organization was after you did contact Rare Cancers Australia, because you said they were the first one that wanted to hear you as a patient and were willing to share information in an open way. And this man thrives on information. Without it, he gets quite grumpy. So that was a nice day.
That doesn't do justice to Adri, but yeah. It's all about people helping people.